One of the things that I love about the trauma-informed care movement, whether it's SAMHSA's model or sort of the other models that have been built around this, is the idea that all of us have been impacted by trauma, professionals and clients alike. And so I'm so appreciative of you sharing your own story, Rick, in the process of talking beyond that to the trauma-informed work that you do. Because what I really love about it is it really levels the playing field, that nobody is immune from being impacted by the world and the events that we go through. And so I think that segues nicely into our final speaker. Dr. Mark Sander is the Director of School Mental Health for Hennepin County School District in Minneapolis Public Schools. There's been a really wonderful movement that's been happening in the last decade or so where education systems have begun to embrace the idea that trauma is playing a significant role in the behavioral issues that are showing up in their schools and the difficulties that some children have in going through the school system as we've built it. And so our schools are built around highly functioning children, and some people come into those systems where their functioning has been disrupted by the experiences that they've gone through. And so Mark is at the forefront of that work. Don't laugh, it's true. So Mark is at the forefront of that work, training schools, particularly around the state, but also more broadly, in how to take a more trauma-informed approach to their students and into the work of the faculty and other educators. And so thank you, Mark, for being here, and I'll turn it over to you.
Either I do too many PowerPoints or I'm just too chicken to step away from them. But I'm going to take a little bit of different approach from the previous presenters, and I'm actually going to, I've got a couple slides, and for me it's really about me staying on track. So this will be helpful. And it's also, I think, for me, I do a lot of speaking on this topic, and so I'm going to kind of share some of the things that I talk about the most with schools when I'm doing this work. I will say this is typically about a 3-hour presentation that I do with school staff, so we're going to do it in about 15-20 minutes, so hopefully it's enjoying. So one thing I want to honor is I was very blessed to be a part of the first cohort that got trained by Dr. Rob Anda, who was the original co-investigator on the original ACE study, and then Laura Porter, who was the director of community programs at Washington State, and they developed a curriculum on kind of how to have this conversation about adverse childhood experiences in the community. There was 25 of us trained back in 2013. Since then, I've probably given about 90 presentations, mostly to educational audiences, on ACEs and adverse childhood experiences and the effect on students' behavior. All right, this is just to remind me to relax. I get nervous, and when I get nervous, I start talking fast, and then you start looking like you don't know what I'm saying, and I get more nervous. So this is a picture that I borrowed from Nancy Riesenberg, who works at MDE. We've presented together before, so this has helped me to settle in and relax. So there's some grounding assumptions that really are critical to the work I do, and usually when I'm doing this presentation, there's a whole bunch of slides that come before this, but we're doing it quick today. So the thing that I talk about with educators is our central nervous system's main job is to help us adapt to stay alive. And it does that 24 hours a day, 7 days a week, whether we are asleep or awake. And because of that, oftentimes it's making those adaptations on autopilot. It's not a conscious decision that we're making to take on this adaptation. That'll become important later. What we repeatedly experience is what gets wired into our brains and our physiology. And sometimes people can feel like that's kind of fatalistic. But for me, I really see that as that's a place of hope for schools and for organizations like you're talking about yourself. That repeated experience is where we have a choice. As a school teacher, as someone, as a whole school, what is the repeated experience we want students to have at our school? We can wire them for a different experience at school if we so choose. Our experiences and the adaptations necessary to survive those experiences are what gets wired into our brain's biology and perceptions. Misbehavior often occurs when survival adaptations clash with social expectations, with the expectations of school, to sit nicely, like you all are right now, right? For some students, it's not safe. For some students, they'd be very comfortable standing here, because I can see all of you, and the threat is out there. It's not in here. And you're going to see me repeating. Again, coming at it another way, behavior, or what is seen as misbehavior, may not be a choice, but rather normal biological adaptations to toxic stress and adversity. Okay. This is huge for teachers and educators. If we stop seeing all of the students' misbehavior as a choice, what does that mean from how we need to respond to that? And then misbehavior might be the successful adaptation in another setting. Right? Our central nervous system, right, helps us adapt to stay alive. These adaptations aren't wrong. They just don't fit this context. It's critical to underscore that traumatized children's most demanding behaviors often originate from feelings of vulnerability. Okay? And oftentimes we need to be reminded of that. I used to work actually here at Wilder, over in the residential treatment center that unfortunately no longer exists. And I got beat up, I got spit on, right? And and you've got to get to a place where it's not about you. You've got to get to a place where you don't think it's about you. And I didn't know any of this back then. I wish I did. It's not really, the question isn't what's wrong with you, but moving to the question being, what happened to you? So these are some of the things that I really try and bring in about everything I did right there is about 40 minutes in my talk with schools. To really try and get them to understand how the biology and the physiology and how our central nervous system and those adaptations aren't choices. Okay? Because we think, oh, you just swore at me. You just got up to walk out of the classroom. And that was your choice. Right? And we're going to consequence those choices. But what if it's not always a choice? What if we're not able to explain why we're feeling that way? Because we don't have the tools. So developing trauma-sensitive schools, this is just a few of the critical components of it. It's building this awareness of the impact of adversity on development. We really have to have people open up to understand behavior from a different lens. Then it's about developing trauma-informed beliefs, assumptions, attitudes, collectively, as a school, or maybe just in your classroom. How are you going to develop how you think about this? Ongoing professional development. And that this means group and individual reflection and discussion. I come into the schools and say, this is about changing adult behavior. This is about changing adult behavior. They don't always laugh or think that's funny, but that's what it is for me. And then working on alignment of policies, creating a safe environment for staff to try different approaches. And especially in our school systems right now, without there being implications for their performance evaluations. Right now, with teachers under so much scrutiny for performance, some of this developing more trauma-sensitive practices can be difficult, or their school environments might be such that they can't risk it. And so we've got to have that conversation as well. And then the importance of self-care. I think that's the big thing, especially working in schools. We can get really focused on the children, which is super important. But it's the adults working with those children that also we really make sure that we're taking care of ourselves, and that that's a really important ethical responsibility for us to make sure that we are safe and healthy, so that we can be our best selves with those students. 6 really important elements, I think, for the adults working in these schools. Adults must adaptively change behaviors, assumptions, and beliefs. Much of what we have, much of what we need to create trauma-sensitive schools already exists. For the educators in the room, there aren't any new magic bullets out there. I think there's all the information about understanding trauma is one piece, but in terms of what interventions and practices we need, we have a lot of them already. All the school staff need to be involved in the professional development and reflection process, kind of like you were talking about with your staff. It's a whole, the way that it's going to work best if we are all doing it, because then we can create these repeated messages, these repeated experiences for students that they can have with all of us at school. School leaders must create an environment where it's safe for adults to share and reflect on practices and beliefs. That you're not going to get the shame on you for thinking that way, or looked at funny because of, as you're trying to think through what's going on with the student. We've got to be able to be open about that, to really, because that's how we're going to change our behavior on a real internal level. We need to focus on student engagement with positive school-wide engagement plans linked with positive classroom engagement plans. This is some of the work that Minneapolis Public Schools is doing right now. And then again, we've got to remember, kids are in schools to learn. And so one of the things that we can do to really engage students is provide high quality, relevant instruction to engage students in learning. Schools are a place of resilience, and that's what I remind all these schools when I'm working with them. They are a place of resilience. We can make them even more resilient. We can recognize them as educators that we are building resilience and embrace that and pat ourselves on the back for that. And they can do this by making sure that they are environments that are stable, nurturing, and engaging. And positive, healthy relationships are critically important to creating and sustaining healthy and resilient environment. But here's what some of the things that I hear from schools sometimes. Right? There's a pushback. There's not enough time. The professional development days that schools have, if there's any educators in the room, keep going down every year. And the amount of required professional development, either from the state or the federal government, goes up. Okay? So there's really a very difficult time to get this in. And so schools and other people in the educational and parents and people in the community say, schools are about education. But you know what? If we don't, and many schools and school districts recognize, if we don't pay attention to adverse childhood experiences, they're going to get in the way of a high quality instruction being successful. We've got all this focus on getting teachers to be able to deliver high quality instruction in math, in reading, in writing. But if our students aren't in a place where they can hear that, and their bodies aren't in a place where they can take it in, it doesn't matter. Do we need to reframe what education means? There are discussions going on about whole child learning approaches and social emotional learning. Okay, we need to support those and encourage those. What about the national standards? What about high stakes testing? This is what schools and teachers are being evaluated on. We need to support them by shifting the conversation, or at least help prioritize social emotional development. And then I also get I'm a teacher, an educator, I'm not a therapist. And I say, I'm not asking you to be a therapist. Okay? I'm asking you to be a positive, consistent adult, caring adult in their life that is going to have an enduring relationship with them. So here's some of the challenges with this work. Some of the challenges are time. Like I said, there's not a lot of professional development time. And to provide the coaching, the training, and support that's needed to do this well is difficult. Some of the what do we do hasn't been fully developed or evaluated, but there are frameworks out there that exist that we can move forward on. Many of the interventions and practices and programs we already have. So the upside of that is we can easily kind of redeploy them, or people are doing them, or we can just kind of do more of them. The downside for some people is it doesn't work. I tried that before, right? But now maybe we didn't have the right focus or the intentionality or the understanding about what part of social emotional development was this really targeted on. We need more support needed for staff. Again, the training, time for reflection, discussion of as a group and community, and again, self-care. Self-care is so important. And as somebody who works, as a helper and a healing professional, someone in kind of public service, I know that for myself, self-care would be the first thing to go when I got busy. I'm trying now to do a much better job over the last couple of years of not letting that happen, because I think it is my responsibility to take care of myself so that I come in a good place. And I think we need to be having that conversation, and that needs to be okay. It needs to be an ethical responsibility for us within our profession. And then also I want to talk about not just focusing on trauma-sensitive schools, but trauma-sensitive communities. How do we get this information out to parents and other individuals in the community to help support the schools and have this message going on? So there's hope, possibilities, and promise. I think that there are a number of frameworks out there right now. The Composite Schools monograph, you'll see a slide about that in a minute, comes out of Washington State. The Wisconsin Department of Public Instruction has been doing a lot on creating trauma-sensitive schools. There's a whole kind of series of books that comes out of Massachusetts on helping traumatized students learn. As I mentioned, I was part of the first cohort about 3 years ago. They got trained in this ACE interface curriculum. Now there's been over 90 individuals trained. And there's a tremendous amount of expertise in our schools already. And I think I was doing some work in St. Paul and doing some of this training and then monthly consultation and then actually going into the classroom with some teachers. And what floored me, I would observe them for 10 minutes and I'd give them some positive, and we give them feedback. And oftentimes it was mostly positive. And they were in tears because there was so much self-doubt about how they were as educators, because it's hard and because you're doing these things over and over again and it doesn't seem to be making a difference. And the repeated experience that we're talking about isn't 20 times, it's not 50 times. We're talking about hundreds of times.